Haimanti from Silchar is an extremely talented upcoming ophthalmologist. She is the editor of Journal of Ophthalmological Society of Assam, and she has taken up a very important subject of very dynamic subject of dry eye analysis, which goes on coming up with, comes with newer diagnostic tools, then therapeutic modulations, and better understanding of the problem, including the meibomian gland dysfunction and inflammatory biomarkers and whatnot. So we'd like to know some innovative analysis process from Dr. Haimanti.
A hearty good afternoon to one and all present here. At the very outset, I'd like to thank Chairman Scientific Committee, AIOS, as well as OSA for giving me this opportunity to be a part of this session. I'll be talking on innovations in dry eye analysis. It's not moving.
Every time it is like that, it will move.
I, I do not have any financial disclosure in this presentation. So basics are always basics. So before we go to any diagnostics, we have to stick to the standard clinical evaluation. And herein, the history taking has a very good role. So dry eye questionnaires are quite underrated, but they have a very good, gives a good subjective assessment of the discomfort that the patient is having. So it is quite imperative to differentiate between the type of dry eye, whether it is a lipid deficient or an aqueous deficient, because that will modulate how we want to treat the eye. So this is also very important that we make this differentiation. So ocular surface disease index questionnaire is the one that we mostly use, and we can tell the patient that it is not just a form to fill up, it is something more important, so that they will do it sincerely, and based on that we can differentiate the symptom as mild, moderate or severe. So the examination protocol that we would like to follow is first the slit lamp evaluation, wherein we do the tear breakup time, the tear meniscus height, then the ocular staining. Staining, we have the option of rose bengal and lissamine green, but we prefer lissamine green because rose bengal is little stingy to the eye. But we have to follow a standard scoring pattern, and there are many actually in literature, but whichever standard scoring pattern we follow, it is important that we consistently follow the same pattern for all the subsequent visits. Next, we do the standardized Schirmer test, and I am definitely not going to tell you how to do that. We all know. And finally, we have to do a lid eversion to know about the meibomian gland health status. When we talk about imaging in dry eye, this is a market which has boomed like anything, and you name it and you have all the new devices coming up. But then it is again not possible for all of us to purchase all of this. So then they do have a role of this multi-imaging integrated device. These are, I would say, is an addition to your armamentarium of dry eye, because they do multiple functions of interferometry, meibography, and few other functions also. So these are kind of helpful. So the device that I have been mostly using last few years is the dry eye analyzer, which has the facility of non-invasive breakup time, the tear meniscus height, infrared meibography, and lipid layer interferometry. In non-invasive breakup time, we basically project Placido's disc-paced light with white light over the cornea, and it gives you an idea about the first rupture time, the average rupture time, and it gives a breakup distribution, and it generates a heat map kind of a thing. The red, warmer colors are dried area, and the cooler colors are all right, normal areas. Coming to the next, tear meniscus height, it is done with an inbuilt ruler, which is placed in line with the pupillary center, and if it is 0.2 and above, it is normal. Anything below 0.2 is abnormal. Infrared mammography is based on the autofluorescence of healthy mabum when infrared light falls on it, and it is captured by a coupled camera. The first image is what you get, and then an image of AI is imprinted on it, and you can know about the amount of gland loss or gland dropout. The first picture is a normal mabomian gland. The second one is a grade 2 MGD with about 40% gland loss. And the third is grade 3 MGD with around 70% gland loss. The fourth function that it does is the lipid layer interferometry, which is based on the principle that when adequate white light hits a lipid layer, there is generation of interferometric fringes. The first video top left, you can see there are multiple colorful fringes, which shows that the lipid layer is normal. So this eye, the left-sided eye is the patient eye, and the right-sided eye is the sample eye fitted in the device, and the AI, what it does is it matches with the sample eye provided in the device. And the last video where you see that there are almost no fringes, so this has a very, very thin lipid layer. So this is how the interface looks like. It gives a color-coded report and idea. We also can give the idea to the patient. This is another interface of how the oculus keratograph looks like. This is also another multi-integrated device. Another recent advance is this optical quality analysis system. The tear film optics actually also affects how we see. So what this device does is, in between blinks, it measures the scattering of light. The first picture where it is written pre is a patient of pre-cataract. Here this is a normal scattering, there is not much scattering. And the right side where it is day 1, it is day 1 after cataract surgery where the scatter has increased. So this is an abnormal finding. I do not have any personal experience in the last two devices. Confocal microscopy, the Rohit Shetty group has done extensive studies of in vivo confocal microscopy in dry eye patients, and you see the difference. The right-sided one is a confocal reading of someone who has a normal cornea, and the left is the one with a dry eye. So dry eye, actually there appears a lot of dendritic cells, which are basically signs of inflammation, and also some other abnormal nerve looping and keratocytes. These have been described by the Rohit Shetty group. Thank you very much for your kind attention.
Thank you, Haimanti.